Everybody, we are 5 minutes behind going into it. I know we've got some board members who've got to jet early to get kids, so let's get started. All right, Dr. Brabrand. Crew. I'm about to teach her clap once if you can hear me. Clap 2 times if you can hear me. All right, we're going to get started.
Thank you, Ms. Cohen. I know we're going to be done probably at 3 o'clock. I see that's what it says here on the screen, 3 p.m. Oh, is it 3 minutes? Oh, I thought it said 3 p.m. Good afternoon, everybody. I am bringing you an update, as you know, an instruction and operation update. We are fully returned to school, so there's no more RTS presentations. We have an instruction and operation update, which if you did the initials is IOU. So I owe you an update. Nicely done, huh? I owe you an update on how things are going. No, Ricky, come on, a little fun at 2:05. Okay. All right. Well, terrible. I'll keep working on my routine. All right, well, why don't we start over because that's, boy, audience. I got another joke. Here we go. No, honestly, I do want to bring the instruction and operation update. I have a number of updates to the board. I did share with you 2 weeks ago some updates on our September 9th meeting. And as I shared with you that evening, the continuation of our pandemic requires us to be flexible, innovative, and collaborative in how we respond. We continue and will continue to follow the advice of national, state, and local health experts and monitor health updates. We're also listening to the feedback of our staff, families, community partners, and our board, and are seeking operational adjustments wherever possible to ensure the continuity of safe in-person learning, and that remains our top priority. It is, as it remains in this pandemic, a careful balancing act of multiple stakeholder interest. And I think at the final end of the day, we need to be thinking about the interest of the child. And we're working to do that in everything that we do. So I look forward to sharing some additional data and updates with you and then take questions. So I'm going to move through here these slides pretty quickly. You've seen this slide before from 2 weeks ago. We continue to see very low transmission in schools. Our data indicates only 1/3 of 1%. 1/3 of 1% of our staff and students, 0.33, have reported COVID positive cases in the past month. Over a month period of time, 1/3 of 1%. Only 24 cases have actually had transmission occurring within our 198 schools and offices. I want to thank our staff and students and families for the partnership in keeping these numbers low. It takes a lot of community effort, a lot of extra work above and beyond by our school staff. And I know and I applaud our community for coming together to keep schools safe for teaching and learning. I want to remind you of the definitions if we go to the next page. We talked a lot about isolation, pause, and quarantine 2 weeks ago, but a reminder that I've shared these definitions with you and they're important for our community. The health department directs individuals who are sick or test positive for COVID-19 without symptoms to isolate. That's the word isolation. FCPS may also be directed by the health department to pause in-person learning for a student while contact tracing is implemented as a matter of public health. That is the pause for potential close contacts, and we call that pausing a kid. And then finally, the health department will direct individuals as they go into the contact tracing investigation to have those paused students remain in what becomes quarantine. So the cumulative impact of isolation, quarantine, and pauses, as you know, is greater than the total number of cases. And ultimately, we want to continue to lower the number for all 3 of these areas in our school system. Something I know board members have asked me about for several weeks, and here we go. Ta-da, next slide. Here is our pause, quarantine, and isolation data for the past month. It provides you a complete update, and you can see the isolation and quarantine data is tracked by the health department. The pause data is tracked by us. This 1-month look at our cumulative data reflects the broader impact that a single COVID case has and demonstrates that the percentage of impacted and staff remains low. So as you can see, over the past month, the total number of students paused of our total number of students is less than 1.6%, and of staff 1.8%. That's over the entire month. So really less than 2% of our students and staff have been affected at all by COVID to have to engage in pausing, quarantining, or isolating. But 2% still represents many individual students, many individual staff. And we know the impact for those on this pause and eventual potential quarantine or isolation is significant. We're working with our health partners in the Fairfax County Health Department to minimize the length of time that our students are out while maintaining a safe environment for our students and staff. We're also working with our staff to adjust our approach to supporting students who are out for these COVID-related absences. Some students have actually already been paused or quarantined more than once, which would represent 28 days of missing instruction. So we really need, and I'll be talking to you about that a little bit more here shortly. And I'll share updates on a number of process changes we've made to minimize the impacts when kids are out for COVID-related. Another topic that's come up with the community and with this board, a reminder that questions have been raised and concerns about quarantine length. I do report to you today that our recommendation remains the 14-day quarantine length in partnership with the recommendation of the health department. Now, we've engaged in a number of discussions with our public health experts on this matter. I recognize some other districts are lowering the number. As a reminder, the Fairfax County Health Department sets the quarantine standards based on CDC and VDH guidance. And if we can actually I'd like to put that screen back up, because that guidance can show you there's different levels of risk associated with the different length of days of the quarantine. 14 days, 10 days, and 7 days. The risk goes from, on a 14-day, from 0 to 3%, to a 1. Can we get the screen back up? I assumed staff was. And it was slide 8. So VDH on slide 8. Oh, well, maybe, I don't know why, maybe. 5, sorry. Yeah, there you go. That's what happens with the social studies teacher. You can see the VDH has the quarantine days and the associated risk. Look at 14-day and go down there. 0 to 3% risk. 10-day is 1 to 10% risk. This is the risk that the person will become positive after that day, day 14, then day 10, and then 7-day, 5 to 12%. We don't want to bring people back in that reinfect the school. The other nugget I want to tell you, and this is a nugget, this is a Dr. Brabrand nugget, that VDH has shared that this information is not yet updated from the Delta variant and its time over the summer with us. I really very much want to see the updated risk information. I recognize that we need to continue to revisit this on a regular basis, and we will with the health department and also with you all. But we want to be sure that our numbers are low and that they remain low in Fairfax County Public Schools. So I will keep you apprised of our continued work on this area at this time. The health department continues, and I continue to recommend the 14-day quarantine length. The next slide is something around, again, our work to work with the health department in closing cases. And yes, we certainly have heard, and I know many members of the board have, about the number of days a case has been open. We're being transparent with the data here, very transparent. The number of cases has risen over the last 3 weeks, with cases that are still outstanding even after day 5 or day 7, or yes, in day 10, 12, 13. While these numbers are low for the overall total population of FCPS, there's been an increase in cases week to week. We know that as these cases have increased, the time to close them has increased as well. So we've got work to do here. Each of these cases does represent other students or staff members who may have been contacted prior to the case close date with the direction from the health department to return. The date the case closed represents the completion of the contact tracing and notification by the health department. It does not necessarily coincide with the date an individual student or students were authorized to return. For example, during the week of 8/29, there were 21 cases closed on day 13 of the pause. Some students and staff associated with that case could have returned on day 2 or 3, depending when they were contacted by contact tracers from the health department, verifying that they were a close contact and what their vaccination status was. And we'll talk a little bit more about that, where we've been able to speed up for our secondary kids being able to be relieved from being paused or quarantined with a vaccination status that they are vaccinated and being asymptomatic. But we need to acknowledge that some cases have taken several days to close, and we do want to share with you some updates with the health department to address this issue of the rise of days in getting cases closed. So let me talk about that on the next slide. Some current enhancements that we've done. We've allocated additional funds to allow schools to hire staff to assess them with COVID management. It's been a significant lift on top of normal day-to-day operations for principals and school staff. We've worked with the health department to adjust a number of processes, including streamlining the return of fully vaccinated asymptomatic students, as I just mentioned. The health department implemented the vaccination verification survey September 7th. That's really expedited the return of those kids that are vaccinated and asymptomatic, so that contact tracers can work on those that are not fully vaccinated who've been exposed potentially. We also work with the health department to streamline our red cap reporting. This is the process we use in schools to inform the health department of a potential positive, staff, student, or visitor case, and then to identify close contacts. Starting just a few days ago, September 16th, schools now only enter case information, the list of close contacts, and contact information for families. Schools are no longer required to provide additional documents, as it was determined the additional documents are not needed to fulfill the contact tracing process. We were handing over to the health department all kinds of seating charts and other ancillary material. They just need to know who are the potential close contacts. So that's going to narrow the searching, right, for the needle in the haystack as we go through these contact tracing processes. Finally, the health department has shared that to deal with the current large number of paused cases, beginning on the 16th, contact tracers are starting to reach out via email in addition to phone calls to expedite the response. This is intended, this email solution, to be a temporary solution to address the large number of pending cases. We will start to see an impact of these adjustments when we get the final closed case date of the week of 9/12. So we'll obviously update that chart for you all. Right now, as of September 19th, there are 94 cases open, and we won't see the impact of those adjustments until probably next week. Anecdotally, we are hearing, though, from principals about the improved processes and the faster return of students, and we'll continue to monitor the data from the health department and provide you updates on this trend. We're also working on an improved data exchange from the health department that will come out later this month or early October that will reduce the manual entry of information on the school side. So we'll have school involved in less time having to pull together the pause data, which they're doing manually now. And we'll provide the board with additional information when that's finalized. Just a reminder on the next slide about student contact tracing, who's responsible for what, which is often asked. We have had a number of questions about that. Now, we are responsible for notifying the health department whenever there is a positive case in the school and for providing a list of potential close contacts along with the contact information for these people. So as I shared in the last slide, we've worked on a number of process improvements to improve getting this information to the health department in the most efficient way possible. so we can get back to focusing on our school staff focused on students and instruction. We're also responsible for sending the pause letters to those identified as potential close contacts as directed by the health department. And we're responsible for communicating with families after the health department has determined a student's return status. Now, the Fairfax County Health Department, they're responsible for conducting the case investigation and the contact tracing, determining the close contacts, the actual close contacts, not the potential ones, but the actual ones, and then providing quarantine or isolation guidance as appropriate. The health department also is responsible for reviewing all documentation associated or submitted in association with the positive case and reviewing all of that information. The health department is also responsible for determining when students can resume normal activities, and the health department provides the clearance letters to families. Finally, the health department communicates student return dates to families and designated FCPS staff. The family has a role too in this process, believe it or not. They have a role to notify the school if their child tests positive for COVID. They have a role to share if their child is diagnosed with COVID or is directed to quarantine or isolate by the Fairfax County Health Department or by their child's physician or any other medical provider. So we really need families to communicate with us as well. Families also need to be playing a part in completing that health department vaccination verification survey so they can expedite the return of their student if they are that child is vaccinated and asymptomatic, so they can return from being on pause. And again, I want to remind our families, as we all know, that, and we've all had to do this, is to remember the importance of part of staying safe is when you don't feel well, you stay home and keep children home when they are ill. We cannot have kids come to school who are not feeling well. We do have a comprehensive flow chart, if you go to the next slide, that outlines the COVID response for families. It's available on our website, so folks can understand the process and to better understand timelines. Our principals or their designees are expected to complete the red cap report of a positive case to the health department within 24 hours of receiving the report on business days. 24 hours to put into red cap, our school folks to put into red cap the positive case. The health department's goal was to complete the contact tracing within 48 to 72 hours. However, case responses vary, with some cases taking several days longer than that, and you just saw that on the slide. There are days going beyond that 48 to 72 hour limit. If we go to the next slide around testing and vaccination, I want to give you an update, though I gave you one just 2 weeks ago. It's important to continue to track this very carefully. 87% of our staff have completed the survey. Almost 97% of our staff who responded are fully vaccinated. That is a superior vaccination rate. We're busy following up with those who have not completed the survey, and we'll be working program manager to program manager with individuals to get the rest of that data. We do anticipate we'll start our testing program in late October. We have heard from our local health partners that there's a significant strain on capacity for testing at this time. Every employer in America, over 100 employers, has been directed by the president to begin to have a testing process in place. So we are going to need to just be clear-eyed that testing is going to be a capacity thing that we need to continue to monitor. We're working, again, as I mentioned to you, with the vendor, and we are having favorable work occur, and we'll have an update with you very soon. And we, again, anticipate starting our testing program in late October. We're also encouraged with news that's broken just in the last 48 hours about developments that indicate children 5 to 11 will be eligible for the vaccination in October. This is huge and honestly will be the next game changer for our school system and our community. And if we can have the vaccination rates for 5 to 11 like we've had for 12 to 17, we will really, really dial down the anxiety that has existed since school has returned in person. In the past, we have stood up vaccination clinics in schools with our older children, and as we prepare for children under 12, We are planning to do a survey to get some additional feedback from our families to determine the best approach on options for our younger children, such as vaccinations during the school day, with the school acting as in loco parentis, even with some of the little kids. I know we're surveying our community. We're surveying our community to understand what our families want. Some may want us to act as in loco parentis. We'll see what the data says. Michelle is here and we'll give you any updates you'd like. We're also looking at whether to use the school facilities to stand up weekend vaccination clinics or the likelihood that families are going to access their child's pediatrician as they did before the vaccination. I want to, again, be full candor. Many of you have been hearing from our pediatricians that they too face tremendous strain right now and are concerned about vaccination of 5 to 11 with everything else that they're dealing with. But these are the conversations that we're having. And Dr. Boyd and I met with the pediatrician president of the Virginia Association of Pediatricians, who is here and practicing in Fairfax County. We met with ANOVA and with the Fairfax County Health Department last week and committed to meeting every 2 weeks as we go through some of these big issues around vaccination and the testing of students and staff in our community and in our schools. I'd like to go on to mask policy enforcement. This is a question that's come up too. You know, our community's been incredibly supportive of the layered prevention strategies, mask wearing. This is one of those issues. Our kids really have stepped up. They know the importance. A number of board members, though, did ask for some updates on masks. We've had fewer than 20 documented incidences of mask refusal in our student information system that resulted in a student discipline issue, or that was noted by a bus driver giving a referral for a kid who continued. 20 is 20 too many, but 20 represents still a low number of kids. I believe our students fundamentally understand that mask wearing is part of doing our duty. It's also part of following the law that the governor did direct as we opened school. We do want to remind everyone that students, staff, and visitors are expected to follow our current mask requirements. And any questions or concerns about mask compliance of any individual can be directed to the principal or program manager. Families and staff can reach out to the region or the Office of the Ombudsman if there's unresolved concerns about masks. And students with concerns should share their concerns with their teacher, AP, or another trusted adult if they feel that they're observing someone not following that policy, so that we can appropriately follow up. Students can also contact our Office of the Ombudsman. While we're talking about students, let's talk a little bit more about our instructional support during COVID-related absences. We shared with you some of our preliminary thinking 2 weeks ago and have finalized our approach for instructional support during COVID-related absences. Again, another balancing act of listening to multiple stakeholders, to include our principals, our teachers, parents, school board members, and frankly, our kids. So as I shared at our last meeting, we were working through revisions for how we can provide more than just simply asynchronous instruction to students when they're out for COVID-related absences so they can have more engagement. All of us can agree that 14 days out of school with no contact or engagement with your classroom teacher is not acceptable. As I've said previously, while the percentage of students and staff out for pauses, quarantine, and isolation is low, the impact for those individual kids on these prolonged absences will only exacerbate the current academic challenges many of these kids are already facing, and our data already shows that. Our updated approach is that no later than day 3 of a student's COVID-related absence, the school will provide supports to those students that include live streaming or recording of direct instruction. That will be the teacher determining which of those options to provide. Continued sharing of asynchronous assignments, which has already started since we began. We know a few teachers were working to get their Schoology accounts up and running, and we have worked to provide instructional support for them. And then a regular check-in with the staff member for individual support, really with our hope of doing that every other day for those kids. This check-in can be as brief or as extended as needed based on student needs, and frankly, based on the student content. So wanted to share that information with you. We believe a combination of the three supports, if you go to the next slide, will provide students with what they need as their pause from school and set them up for successful return. And let's just be honest, again, this is about no more than 1.6% of our students so far this month. Pre-COVID, kids were gone. We had prearranged absences where kids were gone for more than 10 days. They traveled abroad, either to reunite with families or for vacation. Now we're seeing, in the middle of the pandemic, more kids that are having, through no fault of their own, the need to have to be paused, quarantined, or isolated. They need to continue to be set for success in this academic year. All students will have access to either live streaming, it's teacher-led instruction through live streaming or through a recording. At elementary, it's going to focus on math and language arts, and at secondary, it will focus on all courses where it's practicable. And that's almost every course. I think it's PE outside is a bit hard to live stream. Students with disabilities will continue to receive a free and appropriate public education through streaming or recording direct instruction based on the elementary or secondary schedule, the asynchronous assignments, and the connection with a staff member. Teachers will ensure supports are provided that allow our students with disabilities to make progress in the general curriculum and advance appropriately toward their IEP goals. We also want to note that the students with disabilities who receive related services such as speech, occupational therapy, physical therapy will receive those services through teletherapy, pending the provision of parent consent for teletherapy. And most parents, yeah, how about that? Well, I'm listening. We've been listening. The staff's been listening to this board and to our community as we should. If a student's not well enough to engage in teletherapy during the COVID-related absence, the therapy provider will work with the family to figure out an alternative plan. For our English learners, we're recommending ESOL teachers both live stream and record English language development lessons for ELs, not having an or there, but an and, because those kids really, really could benefit from having the ability to watch multiple times, that ability of seeing those lessons. For asynchronous work, of course, our teachers will post the assignments to Schoology, which is now universal across our system. And our central office team is working on making asynchronous assignments explicit in our curriculum guidance so that teachers have access to ready-to-go resources from last year that they can easily post for asynchronous instructional support. We also have digital resources such as ST Math and Imagine Learning that we can leverage and will leverage to provide personalized digital learning for students. Important part of this plan is the check-in, the connection to students and teachers and other school staff. And students will receive regular check-ins to support academic and social emotional awareness. We have asked for that to be every other school day. As a reminder, our ESOL teachers and school administrators have open access to United Language Group service for check-ins that maybe need to be facilitated through a live interpreter if needed. A couple of other points just to make to you, and we're wrapping up here, is recommended staffing updates. I want to provide some updates to you based on our existing operational realities of this past month. I've shared to you that bus driver shortages is a concern. Gonna have a sip of water. I don't know if I'd ever told you, I had speech and language services when I was in kindergarten, first and second grade for 3 years. And I successfully exited from that program, but Mrs. Cox, my speech pathologist, would be wondering, what did I not teach you, Dr. Brabram? I've shared in previous presentations that bus driver shortages are a concern, not just locally, but nationally, and you all already know it from hearing from your constituents. We have put in place some initial incentives to attract additional candidates and believe that an adjustment to the pay scale is needed. We have listened to our community and listened to board members who said that we need to not only attract, and we raised the base pay up for our bus drivers to make it market leading, but also to retain our transportation employees. And so I am wanting to recommend for our Schedule H transportation employees a 2.5% MSA that we could make effective beginning in early October, so that we can keep this transportation team moving forward and staying in the FCPS family. I'm also recommending an increase in pay for schedule. I'm also recommending a change in pay for our substitutes. We are seeing challenges in our substitute fill rates. We've talked about sub pay for years, but as we've opened this year, starting the third week of school, we're seeing our sub-fill rates drop below 80%. Typically, pre-pandemic, we were in the 90 percentiles. Starting the year, we were in 80s, thinking, okay, we're gonna get back up, we just need to get folks back in school. But our subs are finding that school in the pandemic remains challenging to do in high community transmission. On September 13th, our sub-fill rate for teachers dropped to 73%. 212 jobs not filled. What does that mean? It means people in the school end up covering for those missing staff members, admin team, reading teachers, counselors, support staff. By Wednesday of last week, we had it drop to 69.5%. Last week, we had a fill rate overall of 61% and 473 jobs not filled. That is not a sustainable operation for our folks. A pay increase will enable FCPS, we believe, to increase the quantity of subs available and the quality of the substitutes and help us recruit more candidates so that we can compete. I'll let our HR folks talk a little bit more about it, but this will allow us, again, to be even more competitive to our surrounding jurisdictions. Our substitute short-term rates would also increase as well as our long-term sub-assignments. We would also make increases to the FCPS retiree rates. Remember, we looked at this a few years ago and actually did it for retirees at some level, but this would be upping it once again. And I look forward to discussions around this for the board today, and perhaps if the board wants to move forward, that action could be taken as soon as your formal board meeting later this week. If we can go to the next thing, I do want to sort of wrap up and just say that FCPS is doing significant work that's critical to COVID mitigation and supporting students during this time. We are really working hard as a team in this first month of school to provide instructional supports for students when they're on pause, quarantine, or isolation. We're continuing day to day to implement those layered prevention strategies in our schools. We're continuing to get ready for the good news that's coming for mass vaccination for kids under 12. We're continuing to implement the staff vaccination requirement as we gear up for that to take effect in October, and to provide the testing for those who have not been vaccinated. And we're continuing to establish those testing programs, not just for our employees, but also for our athletes and ultimately for our students. And we're continuing, as you see today, to respond to labor shortages that are directly impacting our students. And these are labor shortages that I say to you with all due respect, while we're looking at bus drivers and subs today, we have to continue to be thinking long-term. And as we look at safety and vaccination, our educational staff in this county, in this Commonwealth, and in this country, education as we know it will forever change if we cannot get our kids and staff vaccinated. And I strongly believe that vaccination is going to be the way out of the pandemic, and we have to work to continue to figure out how we, and we've had very high rates, can continue to make sure students and staff in this county and every school district in the country become vaccinated, so that school, we didn't just return to school, but we stay in school in person for this year, next year, and the years ahead, and we have the staff and resources to do it. I do want to thank everybody, our staff and school community, for the flexibility, patience, and perseverance over the past year and a half. I know a lot of folks wanted to have this year, and myself included, to be almost normal, and we're not quite there yet, but we are all working very hard to continue to try to do that. We are excited to see 99.5% of our kids back in school in person, And we'll continue to work hard to address all of our stakeholder concerns. And with that, I'll turn it back over to Ms. Cohen.
Thank you. Just a quick time check for everybody. The goal is to be done here at 4. I recognize we were running before we came here about half an hour late. So we're going to all try to be judicious, I know, with our 1.5 million questions that each of us has. I promise I'll try to. And the goal right now is 3 minutes in the first round, 2 minutes in the second, and we'll just keep an eye on the time and go from there. I have Dr. Anderson up first with Ms. Marin after her.
All right, thank you. So I'm just going to jump right in. We have a lot of schools where there are a lot of kids that are on pause. Do we have a threshold or any discussions as to if and when the entire class will go virtually?
Yes, thanks, Dr. Anderson. We are having those discussions, and I'm going to let Dr. Boyd just share some nuance here. We've worked hard to try to keep kids in person as long as possible, but as we're real-time starting to deal with some of these cases, we are looking at our standard for reverting a class to virtual instruction so the kids and the teacher can continue to have day-to-day virtual or real-time instruction. But Dr. Boyd, do you want to add some nuance to that?
Thank you, Dr. Brabrand. It's pretty much what Dr. Brabrand shared. We are working diligently because we know the impact in-person instruction can have to keep as many students who are not identified as potential close contacts in school. There are some situations, as Dr. Brabrand mentioned, where just operationally so many people are out in the class that it results in our having to consider pausing the class for in-person, but we are truly trying to minimize that impact because of the benefit of having students in person. Also, one other consideration is that we have, in a few instances, in collaboration with the health department, paused an entire class because of a number of positive cases in that class. And so in those instances, if Michelle is positive and we have to pause those potential close contacts, Melanie might be out for up to 14 days, and then she comes back and then Mr. Frisch is positive and she's a potential close contact there, so she's impacted again. So when we're seeing multiple cases in one classroom within a period of time, we have that communication with the health department, even if it doesn't constitute an outbreak, to pause the entire class such that if somebody else becomes positive, persons aren't impacted at a multiplier rate. And so that's just some of the nuances, but we are working closely with our building leaders and the health department to address those matters as they arise.
Thank you. And I would be very interested in having that information, but just so you know, my advocacy is for us to be as judicious as possible to keep kids in the building as much as possible. The backlog, I know I asked about that last Thursday. We've had some things in place. You ran through it fairly quickly. Where are we with the backlog?
We don't have the numbers yet. You've seen the numbers are going up. We'll have numbers coming very shortly, Dr. Boyd, you want to share. But my commitment is to share. The numbers have gone up. You see it transparently. And we're very hopeful the things that we did with the health department will start to plateau and then decline. I think we're really probably a week away from seeing plateauing. And then, I don't know, Dr. Boyd, you want to add?
Thank you, Dr. Brabrand. So we're probably a week to 2 weeks away. The new process where we implemented the vaccine verification survey, that has helped. But as we calculate our case length, and Dr. Brabrand spoke about this during his presentation, but just to reiterate it, the case length is open until all potential close contacts have been resolved. And so there are situations where if there are 6 potential close contacts, that case is open until all 6 have been addressed. So there might be situations where Dr. Anderson has returned at day 2, Ms. Marin has returned at day 3, Ms. Shomess has returned at day 4, but poor Ms. Boyd, I'm on day 8. And so our case that we're all associated with is going to reflect my length of time. And so that's what we're monitoring. And again, some of these enhancements will bring all of that up to speed, but it takes time to see the full reality or full impact of those new pieces in effect.
Okay, thank you. Moving to the live streaming options, this is the conversation of the day. Teachers are very concerned that this will revert back to concurrent instruction. I am not going to be one who's advocating for us to just do asynchronous, because for kids who are out for 10, 14 days, that does not make sense at all. But we have to do something to try to give some relief to the teachers. I was very excited when you sent that form for volunteers. And so could we perhaps have those volunteers go into the schools so that the teachers can get a break so that they can go do the check-ins during the school day using those volunteers? Can we have counselors do some coverage in the classroom so the teachers can do the check-ins for the kids that are at home? I'm just concerned with the fact that we must have this is now really burdening staff.
So a couple of things there, and then I'll invite Dr. Ivy or any of the RAS. In fact, Ms. Baining, if you'd like to come up as well in a minute, or just to come up and sit if there's other school things, feel free as the lead RAS to do it. But honestly, we are exploring every possibility that we have how to support our teachers. One of the things we did, we listened to our teachers who really wanted the choice to be able to either pre-record where their comfort level or do the live streaming. So that's first choice. The second is support to making sure their choices can be done in a way that limits their amount of impact. We know it's more work, and we had long and passionate discussions about this, but it's also balancing that we all are in this business to focus on the needs of a child, every child by name and by need, and none of us could in good conscience could say leaving a kid to 14 days to go through online materials by themselves is supporting the mission of Fairfax County Public Schools. So it's tough. This is a temporary solution for what I hope is a temporary condition, and that we'll see the number of paused, quarantined, and isolated kids decline precipitously in the weeks ahead as vaccination happens for 5 to 11. I don't know, Ms. Baining, anything you'd add, or Dr. Ivy?
Yeah, thank you, Dr. Brabrand. It's a great question, and I appreciate the brainstorming of ideas to support our teachers, because we certainly, as Dr. Brabrand said, understand the load this is for them right now. And I would say many teachers came forward and said, I want to stay connected to my students. I want to provide them with the instructional support. So I think while it is another sort of ask for them, they are so student-focused that they know it's the right thing for us all to do for our kids while they're out. In addition to that, I think the idea of providing coverage, anytime we can give them additional planning time, is optimal. And as you heard, our sub-fill rate right now is so low that unfortunately I just don't know that we have that luxury. And we can certainly answer questions relating to that.
And Dr. Anderson, I'll just add, I do know that in some schools, they're using flipped classroom models, particularly with our older students, in which the teachers are record their lessons and provide them ahead of time before class. And so in some cases, they do that as a team, a content team. And so that is one way, depending on how the school operates, in which one person will record and then, and then they answer questions in class.
That certainly would help to get ahead of this. I want to move into the communication. I have nothing but concerns from our community who want the information as it occurs rather than weekly, because there are family decisions that will be made and have been made once they have that information about their children's participation in class or coming to school that day. That weekly on Friday, it's really something I'm hoping can be reconsidered. I know you and I have talked about it briefly. Are we any closer to any reconsideration on that?
Well, I've certainly have heard your feedback offline, and I'm listening to the feedback that the board shares today.
Okay. Similarly to the teachers, I want to say that our principals, I think, are drowning, especially the ones with a lot of cases. This is all what they're doing all day long. I'd like for the same consideration that I just asked about for the teachers, for them to be provided some relief with the COVID-related work, in addition to all of the instructional work that their job involves. Mask wearing. I did raise with you the concern about masks, and now it's on the buses, whether or not it's being reported, whether or not schools are acting upon it when bus drivers are reporting it, and lots of concerns about those windows not being open. I know that bus driver communication had said that every other window has to be open as of August 27th. I see the buses every single day. I cannot attest that I see that happening.
Mr. Smith, if you want to share, or Jeff, Mr. Planenberg. I don't know if Jeff's here.
So I have no information to share, new information to share, but we will certainly follow up with Ms. Furby and the bus drivers to ensure that those windows are open.
Dr.
Yeah,
Braber?
the only thing I would add to that is that we do constantly follow up when we do have information, much like you just shared, Dr. Anderson. Well, we follow up with not only the drivers, if people get the individual bus numbers in terms of the windows being down, but in terms of masks, we have a protocol that's in place that's been followed, and you heard Dr. Braber mention the numbers, and anything that comes up, we'll continue to follow with that. But anyway, whenever there are issues with windows being not being down, we go ahead and, as I said, we're following up with each individual case.
All right, Mr. Flattenberg, I'm going to start jotting down bus numbers and emailing them to you. My last thing is really more Mason-specific. At Glasgow, during their back-to-school night, there was supposed to be a vaccination clinic, but it went all virtual, and that clinic has not taken place. I'm really pleased, begging for that to be reinstituted, because that's a community that really needs it, and having that convenience of having it on at school, it's really important. So please do that. Similarly, I am hearing a lot from our Mason parents. They're not seeing those outdoor lunches. Their kids have yet to be outside on September 21st. I don't know what else to say in terms of please let them have this thing. I see tents that are unused. I literally have asked, well, can I take this tent from here to put it over there? It doesn't make sense that we have tents that are not being utilized in any way. What is happening? Okay.
Your time's up, but I did not do that. But I'm going to do it next time.
Well, let me, on the, Francis or Becky, anything you want to share as far as the vaccination clinic? We can follow up, Dr. Boyd, I'm sure, with the health department about doing the clinic at Glasgow if it was scheduled. Becky or Francis?
Sure, I was just going to start with Dr. Anderson, your question about our administrators, and thank you for expressing care for them as well, because they are COVID case managers right now. That is the reality, and for them, that's a struggle, because they're built to be instructional leaders. And so we do, schools do now have funding where that many of them are hiring COVID case managers. And so, you know, and same with lunch monitors, supervision at lunch, to use those additional spaces has been a challenge. And so again, many of our principals have jobs advertised for lunch monitors to bring those people on board to be able to expand lunch, you know, into multiple spaces, indoors and outdoors. So those are some things that they're currently underway in many of our schools.
I would just add, you know, we all sit in these positions sometimes, and you all are out to the community, get close to the reality. If you are seeing a persistent issue with community saying that you're not seeing any use of outdoor lunch or tents that aren't being used, you need to let me know, as well as the deputy superintendent, so we can follow up specifically with that school and work. At the very, very beginning, of school, we encouraged it, but didn't say it was an expectation. We revised expectations after school started. I take accountability for that. That's me. We have shared those revised expectations, and we can work to get the word out. Yes, through the fall and through this year, those tents are going to be up, and we want to have kids as much as possible be able to be outside and be in alternative spaces beyond just the cafeteria. Thanks.
Perhaps adding it to the safety team reviews.
All right, we have Ms. Marin, followed by Ms. Keys-Gamarra.
Thank you. I want to share that I've spent time since the opening of school following trails of constituent concerns about students being paused and not hearing about the status of being cleared to return, and I'm glad to see data about that today. But also, you know, these pauses affect not only the students, but their families. As some of you know, I have a constituent, both the parents are teachers. The third grader was paused, impacted 280 students learning. So I'm really glad that we have more data about that. And as I've tried to find solutions for students and staff, I've had many conversations with policymakers and health practitioners, and it's really led me to be focused on the medical safety of children, but also in balance with the academic, social, emotional, and physical developments that children need. And what is emerging that I see is that the children's vaccination is a means to an end. Okay, it's improving instructional experience and the experience for staff, And from what I've learned, I'm deeply concerned about the preparations or lack thereof for mass distribution of children's vaccines in Fairfax County in the upcoming months. And I'm happy to tell each of you later when we have more time all about what I've learned. But to that point, I think that I would like to bring on Thursday a motion to direct the superintendent to convene a meeting to plan for this mass vaccine rollout, because we even here just talked today, are there going to be vaccine sites in FCPS? Are there going to be sites in other places? We have a lot of people in the community who want to help. So let's get them together and convene with all the resources of our staff, of other partners, public and private, and community. So I will be sharing that for the board's consideration. Relatedly, you know, the work that we're doing, and, you know, when I see Dr. Boyd not only leading things like special education services, but collecting data for contact tracings for the county department, that whole process. You know, the system by which vaccine records are now relayed to the county, establishing a COVID testing program. These are public health, this is public health work. And so I do think that it's necessary to move towards what I've seen Montgomery County do just recently in hiring a public health officer. Maybe it's a deputy assistant to the assistant super for special services in public health, but I do also plan to bring a motion for this Thursday that will direct the superintendent to create and hire a public health officer position. It just seems like this is here to stay, like you said, Dr. Brabrand. Relatedly, it would be, a motion would be appropriate to direct the superintendent to adjust the ESSER budget for more health-related needs, including testing, vaccines at school, but above all, this position for a public health officer. So I will, and the last thing I'll say is about this 14-day quarantine. We see that Loudoun just reduced it to 10 days, no test. I understand there is an appetite. There is not appetite for this in the county health department, but I urge us here to continue with our advocacy alongside the American Academy of Pediatrics. Thank you.
Let me just take the last one. The county did have a meeting today. I mean, I'm always just going to be transparent. That's all you've come to expect from me. And the chairman made clear that, you know, in the end, schools do determine the quarantine length. I had the chair of the county made clear that the schools ultimately determine the length of the quarantine length, separate from the health department while they issue their guidance. I'm sharing with you that I had my meeting with Dr. Gloria. She shared the data, that this data still doesn't have the COVID variant mixed in, and it gave me pause. I'm not going to say today to this board that this is 14 days forever. I'd like to spend a little bit more time to look at the data, to continue to consult with the medical community folks, and I know the pediatricians folks are ready for a lower number. I want to keep our COVID transmission low. I also know the impact when you're staying out 14 days. I think it's a balance, but I'm not committed to 14 days forever. I really would like to see what the Delta variant numbers look like for that risk ratio that you saw on that chart that has the range. Thank you.
Okay. So I want to start by saying I understand there is an incredible amount of coordination that has to happen. And this school system has been given duties that one might typically think belong to the health department or other entities. And so I just want to start there. With having said that, I do want to respond to my colleague's mention of a new position. I think I would revise the motion slightly to give our staff an opportunity to gather that information and bring it to the board as to what is necessary. Because I do think we are often using our same staff members to do things, and perhaps in your judgment in making that determination, that does mean we need to have this person. Or it may mean that we, are grabbing, perhaps one of our nurses, or I don't know enough. I don't know enough, quite frankly, to know how to do that. And so I don't want to presume that we know, right? I would like for our staff to tell us, how do we put this plan together? Certainly, we need vaccination clinics. I think we've done them before. So how are we going to do that? How are we going to oversee that? I'd like to hear from our staff as to how you recommend that, and then I think we can give a response. But I am a little uncomfortable coming and just saying, go hire this person, because I think that we have to start with our operational folks and go from there. I noticed that you mentioned that there's an anticipated start date for student and staff testing. Can you give us more detail on what you expect that to look like? Because I didn't quite get it from reading it, and I suspect the public didn't either.
Sure. Mr. Smith, do you want to talk a little bit about the vaccination process that we're looking at? Excuse me, the testing process that we'll be looking at with our vendor?
Sure, and it's a two-pronged process that we're looking at with our vendor, where we're focused on students and staff. We'll start with the student aspect. We would be looking at providing that testing for students. So we know that we'll be surveying our families with regard to who would be interested in the testing and who would be interested in the vaccinations. And then we would establish sites at this point around the county to provide that testing and vaccination for students, and our staff could also take advantage of those opportunities. Again, for our staff, we'd be looking at regular testing for those staff members who either are not vaccinated and who have chosen not to become vaccinated for a variety of reasons, and they would then regularly go to these testing sites, and that information would be shared with Fairfax County so that we would ensure that our work environments are either filled with staff who are vaccinated or who are being tested regularly. Again, we're working out those details with the vendor at this point, and are on track to the end of October date that we're looking at. That's the information that we have at this point, and we will be updating the board with more information as it becomes available.
The other thing, Ms. Keys-Gamarra, I certainly want to hear more and more board feedback. I will tell you this, privately, we've even been saying the current work that Dr. Boyd has been asked to do, who has become a de facto chief medical officer and trying to run special ed, is not sustainable. We know that. And we have been having discussions about either additional support for her or some, I'm just sharing, and, look forward to continued conversation today.
Those are the kind of conversations I think we need to have. It should, you guys need to tell us at least, I'm happy to make a suggestion, but I'd like for it to be supported. So with respect to what Mr. Smith just informed us of, I would simply say I hope that that's part of the plan that you bring to us, along with a communications plan that addresses all of our communities, because we don't all speak the same language, we have disabilities and things of that nature. You also mentioned in loco parentis survey. That's one of those buzzwords that kind of lights up a community. So I'd like to try to put that fire out right now if I can. I am assuming that will include, I'm glad you found that entertaining. I am assuming that will include extensive communication with parents, guardians, because we have no intention, I know this is what you were communicating, we have no intention of taking the place of a parent, as in ever.
Absolutely not, absolutely not. And I could have Dr. Boyd maybe elucidate a bit more the survey of what we're trying to figure out. And I think it's back to that communication plan and capacity planning as we look at mass vaccinations for our 5 to 11-year-olds. Dr. Boyd?
Yes, thank you, Ms. Keys-Gamarra. So we are looking to survey our families. We know that particularly with our little ones, some families may want to be there with their children when they get vaccinated. And so in those cases, doing a community event in the school so that it's more accessible might be preferable for that family. Some families may be comfortable, if you remember for our secondary students, I'll put up air quotes for in loco parentis, just to allow us, after we've received parental consent, for the health department to provide that vaccination to the students in the absence of their parents being physically on site. And so when it's done during the school day and we have advanced parental consent, we can quote-unquote serve in loco parentis for the purpose of the student receiving that vaccination while their parents are at work or not on site. And so the purpose of us doing the survey is to find out how many of our families, which areas, if there's any, difference between areas, how many of our families are interested in having those school-based clinics like we did with secondary, where their child receives that vaccination during the day while the parent is somewhere else or their guardian is somewhere else. How many of those parents would prefer to make sure that they want to be there with their children so we'd be able to plan for those community sites? And then how many just prefer to just go to their pediatrician because little Sloan has developed a rapport with his pediatrician and he just gets really nervous around needles, and the pediatrician does a lollipop thing really well, and it just works out really well for little Sloan. So that's why we're getting that information, so we can plan accordingly, and our plan really meets our needs without us assuming what our families' needs are, letting them inform our planning process.
Precisely. So I'll take a go back, but I just wanted to emphasize that is a planning tool rather than an authority tool. So
Parent consent will be involved in anything we do with kids and always is. But it's even more important at elementary. And that's the reason we're also doing the survey. We know we cannot assume that the vaccination rollout for elementary kids will be an identical copy of what it was for secondary. In fact, we believe it may be very different, and we need to plan in advance and work with our providers, including our work, about how to do this as seamlessly as possible, because we know when the gate comes down and it's allowed, there is going to be tremendous demand. And how do we get the demand managed in our county very, very quickly and efficiently through multiple distribution channels?
Thank you for that clarification. I could see my email starting to blow up already. Springfield District is freaking out. Ms. Corbett Sanders, followed by Ms. McLaughlin.
Okay, I'm going to try to be real quick at the front end because there's a lot to unpack here. On the contact tracing, I just want to make sure on page 7 that we are not transferring more work onto our principals and away from the county's health department. And so we need to be careful about that. Secondly, on the mask, I agree with Dr. Anderson. I can tell you I've seen a picture of a whole busload of kids without masks. Privacy issues and the employee is in the picture too, in a different picture. But then there's the privacy piece. And privacy, when we're streaming, how do we ensure the FERPA of protecting individual student privacy? Now I want to get to what is really something that a number of us have been working on for a long time, and that's the transportation piece and the increase in pay. Thank you to your whole staff for working with us over a very short period of time to make things happen. But I want people to understand what this actually means. Could somebody clearly state who gets 2.5%, who already has gotten 2.5%, and why couldn't we have done this retroactively?
Mr. Smith, you or your colleague?
So we will do some tag teaming here. So when you look at the bus drivers who are going to get the 2.5%, it will be those bus drivers who did not benefit from an increase when the school board raised the starting bus salary to $22.91. There was a group of employees who were already making $22.91 that we did not raise their pay. And for those employees who did not receive an increase from that initial pay raise, those employees will be part of the group who will receive the 2.5%, along with those remaining bus drivers on those remaining scales. And so that answers the question of the individuals or the employees who will receive additional compensation if the board were to approve this additional 2.5%.
And the timing of October 9th?
Yes, and so this will be effective on October 9th.
So some of the reasons why we're not in a position to make it retroactive is there's a wide variety of impacts or changes that extend beyond just adjusting the pay, but creates a lot of additional steps related to recalculating benefits, deductions, tax that's been deducted previously. And so we have several, or over 1,000 individuals that are impacted here. And so we just do not have the resources internally to go through and make those manual adjustments.
Okay, thank you. So at this time, that doesn't make sense. It would take too long to get money into people's pockets, is what you're saying. Now last, we're going to talk about substitute pay. Thank you for adding the chart at the back of the presentation, but I do believe that this warrants a fuller discussion by this board, since this is the first time this board has seen any of this data, and particularly we need to better understand whether or not this is a demand issue. Has the number of hours for substitutes gone up? Or is it that going up plus the availability, because we know that a huge portion of our workforce do not want to go back into in-person. It's a change. So I do think that this warrants a further discussion. We have a budget discussion on October 5th, and I'm going to suggest that we have that discussion there where we can unpack it. We can also better understand that this is a $4.1 million ask without having real public discussion. And in particular, if you look at this, what we would end up is we would be paying well above the market in multiple categories. And we would only, in some cases, really not meet the market in other categories. And so I don't think that just a uniform adding $2 an hour is a thoughtful approach that really addresses what is the market demand and how do you realize it. And so I'm going to respectfully ask my colleagues to have this conversation on October 5th when we have a budget discussion.
I would just simply say we brought two recommendations. The board could do them in unison or decouple as you suggest and do one after further discussion. Thank you.
Great, thank you. And I know I'm out of time, but can I ask you just one real quick thing, which is I'm going to re-emphasize Dr. Anderson's. We've got to get our kids outside, and it's got to be consistent. Thank you.
Ms. Corbett Sanders, would you like to go back as well? Okay. All right, Ms. McLaughlin, followed by Ms. Sizemore-Heiser.
Thank you. I'm going to try and do this with the calmest voice possible. Dr. Brabrand, did you read the New York Times article over the weekend that talked about COVID testing models that aim to spare students from quarantine?
I haven't had a
Okay,
chance.
I'll gladly share it with you and your team. And I will want to follow up and understand why our Office of Research isn't helping your team with this kind of information. Specifically, it talks about how states like Illinois, Kansas, California, and Massachusetts are now outlining their own test to stay and modified quarantine protocols. In Massachusetts alone, over 2,000 schools are using the state's own procedures where close contacts can stay in school as long as they're asymptomatic, wear a mask, and test negative each day for the 7 days after exposure. I can't emphasize enough with everything in this presentation today. I had my heart and hopes set, along with I think a lot of our families from 2 weeks ago at the business meeting, that we really as a system we're going to take seriously looking at the data and the science. And I totally agree with you about the Delta variant, but that's why the United Kingdom stands as a really great example for us, because they got hit with the Delta variant ahead of us. And one of their leading infectious disease experts just came out with a study that, like our very own data, that shows only about 2% of our close contacts, 2% of paused kids end up actually being deemed a close contact. So 98% of the time in those 1,500 kids that we paused, only 2% needed to have actually then done some sort of isolation. 98% didn't need to at all. And so when we talk about where our focus is, and this is just the 2 or 3 weeks of data we have since school opened, every day is going to be, or every week will be another batch of kids, another batch of employees. So I would say to you, your team, to my colleagues, we're the 10th largest school system. We cannot be behind on this thing. Secondly, I can't emphasize enough my support for Chief Health Officer I've seen in my decade on the board, the health department is not staffed nor has the bandwidth to focus on school health issues. Our clinics are woefully behind the research and best practice that should have a school nurse, especially in high poverty areas. If we get a chief health officer, they not only help us through the pandemic, we will finally, I think, step into the 21st century with great health clinics. So I think I really like the idea of bringing a health expert in. If time permits, I'll need a go back, but I can't emphasize enough, bring down the quarantine and the pause times from 14 days. It's not following the science, and our families, our working families especially, are counting on us, and the kids too. Shoot, I'm going to need one on the teachers because I'm worried about the teachers and this plan we have before us today.
All right, I've got you down, no worries. Oh, Ms. Sizemore-Heiser, I lost her for her, so we're gonna go to Ms. Pekarsky, and then we'll let Ms. Sizemore-Heiser go when she's back.
Okay, thank you. Sorry, and a lot of these have already been brought up. There seems to be a disconnect, and I know that this is causing in the community with the private providers kind of a backup, and is when we have a child that goes into the clinic that has a symptom, we're sending them home with a form and we're telling them you have to go get tested for COVID. And what I've heard from pediatricians is that a lot of times these kids, it's allergies, or they didn't eat lunch, or, this, that, and the other. And what is happening, it's hard enough to find tests. We're clogging up the pediatricians' offices, which means they're not seeing kids who have strep and flu and anything and everything else. So I guess I'm trying to understand, is there any way, obviously we want to be safe, we don't want kids coming back to school sick, but if parents never send their kids to school that day, they don't need the test if they just call out sick. So there is just, I just don't understand how that is logical.
Becky or Francis, I might ask for some help after I say what I say, and you may be able to put the school nuance. We have been working, I know Dr. Boyd had to step out. We have been working, kids that say have allergies, they already have pre-existing conditions that may cause them to exhibit some COVID-like symptoms. They can file that information, I believe, at the school in advance, and it's limiting our need to have them go down to the CARES room and then have to go and face that paperwork requirement. That's my understanding. I don't know, Becky or Dr. Ivy, do you have additional information about that?
My understanding, Dr. Brabrand, was similar, that if they had a documented health condition, that could explain those symptoms, but I think it would have to be documented.
Right, and so I think one of the things we're trying to do is work with families where the kid has asthma and it comes down, you just coughed in the classroom, you got to go down. We want to get that, we want to take that off the schools and those families. So again, I know Dr. Boyd, it's okay. One thing I had just said, Dr. Boyd, because the question was some kids coming down, having a cough or a symptom, then having to be sent home and have to get a COVID test. That kids with pre-existing conditions like asthma or other things, we are working and asking those families to provide documentation that doesn't require them then to go to the CARES room and be sent home. Isn't that right? That's my understanding.
That's correct. And we are revisiting the process for return to school processes for students who are sent home from the CARES room with COVID-like symptoms. We, and Dr. Brabrand may have shared this previously, thank you, that we have heard from the health providers that they're struggling to keep up with getting appointments, and some of our families aren't able to immediately get to a physician, so they may be out of school longer. So we are partnering, and we are actually in the process of revising the return to school form, the 6-student return to school form, which that process and having it to be signed by a physician would be one option of some additional options. We hope to have that information for you in the next day or two. We're just getting the final tweaks on it. But we have heard the response and the barrier that having to go to a physician provides. And as Dr. Brabrand shared, certainly for students who may have asthma or some other presenting allergies. If it's documented on file, those students would not have to be sent home from the care room. And we'll have more information shortly.
Yeah, that's actually great news because, I mean, right now, like, everything is a COVID symptom, unfortunately. So there's just gotta be a little bit more, logic to the way we're doing things. Because if parents are keeping their kids home because they're sick, they're waiting out, what we tell them, wait so many hours, a day, 2 days before you send them back. It just stands to reason there is some more that we could do here. And I've paid hundreds of dollars myself. It is a real burden for parents. It really is. And students at the end of the day. Regarding the live streaming option, I think you said it, but it needs to be said very clearly. This is for a very small sliver of the population. And if those numbers start going up dramatically, I think, we may need to relook and have other ideas about how we are providing instruction to kids. But will those teachers be compensated for the extra time for the check-ins? How are we handling that?
We don't have plans for additional compensation for the check-ins at this time. We recognize it is an additional thing to do. I would say, though, one of the things to think about, let me say something you said, and I want to be even clearer. We are at strained capacity even with these low COVID numbers. If COVID were to get worse, and God Almighty, as a man of faith, I pray every night for relief from this pandemic, we're not going to be able to sustain these operations month after month. It has got to get better. That's why we've got to get our elementary kids vaccinated. The mandatory vaccine is the right thing that this board did for staff. We're doing it for athletes, and ultimately, I believe we need to do it for kids, not just in this county, but across the Commonwealth of country. Our way out. Education as we know it will not, public education as we know it will not continue unless we get kids and staff vaccinated. But so the numbers have to stay low. This is temporary for a temporary situation, a temporary condition. We know, and again, we did the bonus, of course, that's coming in November for all of our staff. Everybody's been asked to go above and beyond, and we can continue to take back the feedback. Are there ways that we can reward our staff, but we don't have any compensation attached to this at this time.
Yeah, I mean, our staff have given a lot, are continuing to give a lot, and we need to find those ways. Regarding that 14-day quarantine, the way it was explained to me by Dr. Gloria, and I really appreciate it, and I'll probably run out of time, is the CDC has put out 5 mitigation strategies to keep COVID at bay in schools. We're doing the masks, we don't have the social distancing, we're doing the hand washing, and the testing has not, come to fruition here for many different reasons. But the other one is this 14-day quarantine. Right now, it's a mitigation strategy. I want to keep kids in school, but I am very uncomfortable saying that against our health department's guidance, we would be, changing that at this point in time while we're in substantial spread, which is what, Dr. Gloria had said. It's not forever. And let's put everything into the vaccination clinics, get a person to run them, get them scheduled. I think that's where we're going to get better.
Wrap it up, Pekarsky. All right, Ms. Sizemore-Heiser, and then Ms. Derenak-Kovacs.
So Ms. Pekarsky, in all her words, covered a lot of what I wanted to say. So I actually don't have as much. So I'm going to say, first of all, I really, really appreciate, I know it's difficult, this live stream check-in portion, especially the check-in portion, because we know how important it is for our kids to have that sense of connection and belonging to their peers, to their teachers, to their classroom, to see those inside jokes and statements made in their classroom that creates that classroom culture. Like, it's just, especially after last year. So thank you for that. Dr. Boyd, we need 2 of you, so what we can do to have 2 of you? Because as you saw from this morning, well, bring your twin, I don't know, but as you saw from this morning in our special ed, like, we need you to focus on special ed. So Dr. Brabrand, whatever we can do to get somebody to take that piece of it, please tell me what we can do.
I think she just said, you actually have a twin? Oh, my. Oh, well,
That's pretty close.
I'll be following up after this meeting. Thank you with the recommendation.
All right, so I just wanted to put a plug in. I just want to put a plug in. We need another Dr. Boyd. She cannot keep doing both of these pieces. She just can't. We need her in special ed. I wanted to ask a little bit, special ed, Dr. Boyd, around how is it going to look to support special ed students who are paused? I mean, are they going to get virtual pullout? How is that going to look in terms of working on IEP goals?
Thank you, and we are working with our principals, because when we talked about this plan, they asked the same thing, Michelle, what does this look like for students with disabilities? Yeah. And we're walking through, so for example, a student may be in a general education setting for the large part of their day, but have 30 minutes of pull out in the resource room for reading. So they would have that in the elementary student example. Yeah. They would have that direct instruction, live streaming portion of ELA or English Language Arts and Math in their gen ed setting. But also if they have the pull out into the resource room for reading supports, that direct instruction in there would also be live streamed, because that's a part of their direct instruction pieces. And so we're working with the schools to make sure that they're able to operationalize that information and to ensure that there are clear expectations that students will be getting that direct instruction regardless of their setting. And for our students that, some of our students in Cat B programs, that will look a little bit differently, because we know that instruction is more individualized based on IEP goals, alternate standards, et cetera. But we're working with them to really make that piece more clear, as well as department chairs.
And how does data collection look for a student that's paused?
Yes, so our data collection would continue as it would, as if students were in person. Certainly, we may not have some of the tangible materials, because some of our students are engaging remotely, but as we're ascertaining comprehension or the ability to perform certain skills, teachers could be using checklists to be able to have that data. Sloan was able to do this successfully 3 out of 4 times without a prompt, as I'm asking him something through the screen, or even for some of our students who have visual cues and things like that that are making responses that way. So we'll continue to work with them, but we don't want this to be seen as something that is totally different. We can transfer our practices. They may look different, but we want to have that same idea of the practices. You should be collecting data, ongoing instruction when little Sloan is in front of you, and you should be collecting data when Sloan is behind the screen engaging with you during that individual check-ins and things like that.
So the data's during the individual check-ins, right? Because the other part is just a one-way live stream or
Right.
recording. It's not a...
Right, and also through the submission of the asynchronous assignments, those things are also opportunities for feedback and to be able to check understanding as well.
I'm just going to say what Ms. Pekarsky said. Like, we need to figure out a way to help compensate our teachers for these check-ins. And I mean, it is going to be, I think, more difficult to do this data collection piece for our special ed teachers. And I know, hopefully it's temporary. I believe it's temporary. I believe till the vaccines come in, but we got to do something for our teachers. So I'm just going to put that plug out there, whether it's using ESSER funds or something, because they're going well above and beyond. When you talk about mass compliance, and is there looking at text lines? How are we communicating to people so they know where to report issues of mass compliance? Can students text? That's what they do.
So mass compliance, I mean, I think I spoke to that. Obviously, any principal or program manager, school-based, they can also call the ombudsman and report that they're seeing a staff member or anybody in the school not following our compliance. And I don't know anything else, Mr. Smith, there beyond the principal, program manager, and ombudsman?
What are we doing to communicate that so people know it? Because I think people don't know who to call.
You know what, I'll make sure, I'll work with Ms. Lloyd, and we'll put it in our weekly communication update to the community next week about mass refusal. I have to be honest, and again, I want to hear this, like, I am not hearing about mass refusal going on in our schools. So if we believe it's happening or people are reporting it to you all as board members, we definitely want to know and follow up, and it's not going to be acceptable. People need to follow. It is the state law, and it is the rules that we're going to follow. And Helen is telling me we did communicate it last week. We will re-communicate it next week as well, because this needs to stay part of our culture until we're directed otherwise.
Yeah, and get people, yeah. So, and I agree with many of my colleagues. When you talk about mandated vaccines for athletes and the importance of sort of this vaccine mandates, what are we doing to expand that? Or what are we looking to in terms of expanding mandated vaccines beyond athletes? Can we do anything?
Well, we'll still, Dr. Presidio, would you like to respond? I'll let you respond.
Well, I'm happy to weigh in. I mean, we're still looking at some of the possibilities that might exist in some of our VHSL activities. And we are in conversation right now with legal counsel about opportunities, perhaps to reduce some of the masks in performances in our theater program, and looking and considering whether or not we would require vaccinations if that was the policy adjustment that we make. But we are in conversation with our legal counsel about that right now.
All right, well, I think whatever we can do to do that in a way that's legally allowed, I think is important as a mitigation strategy. One other question, you talk about sub shortages, and Becky talked about the need for subs. I mentioned this before, have we looked into permanent benefited floating sub positions? So it's not, so somebody who want a job has job security and benefits, even if it's just a one-year ESSER funds use?
I'll defer to Mr. McDonald or Mr. Smith.
I would say we've, excuse me, had high-level conversations about that. Ultimately, we're looking at a wide variety of strategies. This pay proposal is one of those strategies. Ultimately, we know that we need to continue to communicate with our subpool around the mitigation measures and the safety protocols so that they're feeling comfortable coming into school buildings and working with our students. We also recognize that we are exploring opportunities to provide incentives for individuals to pick up more jobs. So we have people in the pool and we want to get them motivated to take on those roles. And that could be as simple as putting names in if you work so many days in a row or whatnot, and doing a small recognition or whatnot to show our appreciation to those individuals. Certainly a strategy to consider. Ultimately, there are some pretty significant budgetary implications, but it's definitely not off the table.
And do you know, I've heard complaints from some newer subs saying that they're having trouble having, like, principals reach out to the same people. So what are we doing to making sure principals know who all is available in the pool and they're reaching out? Is that an issue that you're hearing about? Because I'm hearing some concerns.
I haven't heard directly from subs about that issue specifically, but what I can tell you is we have a centralized system. The system automatically dials out. Subs can go in and reserve jobs that they're seeing posted within the system. I know our principals are trying to be very proactive in trying to fill those vacancies. So our subs can indicate a list of preferred schools. Our schools have access to that, and so they are accessing that information and perhaps making those individualized telephone calls to those individuals. Again, this is the focus is on trying to get as many folks in as possible, and so we can work with individual subs if they're being inundated with calls around adjusting their profile in our Smart Find Express system to put some notes and indicators in there to reduce some of that communication outreach.
And I'm assuming recruiting to non-traditional groups for subs, outside of our normal groups. I mean, I keep hearing about all these parents who are quitting their jobs to stay home because of schooling. Isn't that a great pool for subs?
Sure, and so we've asked our principals to assist in putting information in their newsletters. We provided them a canned statement to include as part of the outreach. We're working with colleges, universities, the unemployment.
Those parents aren't college and university. I hate to say it.
No, that's where the outreach through the school newsletters come in. So hopefully those parents are receiving those communications from their schools. We can continue to reinforce that idea. So we are using a variety of different communication strategies to reach different groups to try and bring more folks into the fold.
Thank you.
Ms. Eisenberg-Heiser, shall I put you on a go back if we have time?
Yes, please.
Okay. Ms. Daranack-Kofax, followed by Ms. Tolan.
Thank you, and thank you, Dr. Brabrand, for this update. And while you did state this as well, while our overall numbers remain low, it does not feel that way at all by those that have been impacted by various pauses and those active cases within our schools. I perhaps had a more robust cases in my community, I'm not certain, but talking to our principals, teachers, and families, they are strained. And as you said, as so many are saying, this is not sustainable. The pause, the majority of pauses, as our records show, have taken much longer than 7 days. Do you have an idea why the county's original estimate was 24 to 48 hours when 171 cases so far have taken 7 days or more?
Dr. Boyd, do you want to share?
Yes, thank you, and great question, Ms. Dearnott-Koufax. As Dr. Brabrand shared on the slide, the number of cases and the anticipated goal of the 24 to 72 hours was predicated upon the number of cases that we were experiencing pre-school return. So you'll see on that slide that had the line graph, prior to school opening, our numbers were lower. The response rate was 2.5 days. But as students and staff resumed, we quickly jumped to 6.5 days and 9.5 days. And quite honestly, now we're past that. But our cases are increasing. And so I do think that it's the unexpected volume that has shifted that goal. And that was the plan of those enhancements, to try to mitigate that at this point, to see what can be done differently, because we know it's a challenge for our families and for our students and for our staff. But I do think that it was just the sheer volume and the significant uptick that impacted that target.
Okay, this is not directed at you, but you know, that's a common sense that would have happened. When schools open, we would have had more cases, I'm not certain. So, second part, testing. You know, I've been talking about this since June of 2020, as have many of my colleagues sitting around this table. And I would love to be able to substitute testing as a robust strategy for the 14-day quarantine as one of the strategies. I have to say I'm gravely disappointed to be where we are here without testing. And I understand, Dr. Brabrand, you've explained that to us, why that's happened here. Again, a question as to why is the County Health Department not better partnering with us on testing?
Dr. Boyd, do you want to share any comments?
Sure. Thank you again for the question. As Dr. Brabrand may have shared, a number of superintendents are sharing a similar challenge as it relates to testing and screening testing. There is a statewide model. This acronym is VISTA. Don't ask me what VISTA stands for, but that's the acronym that makes tests available at no cost to schools, and also provides schools with some funding to hire additional people. The challenge that we have, and we've talked a lot about bus drivers, about substitutes, about lunch monitors, and the list goes on, is that we have funds for those persons, but we just don't have the bodies. The other piece that we've talked about, that again, our discussion is not foreign to a number of localities, is we're trying not to add one more thing to schools. Dr. Anderson spoke about, and many persons here around the table, that our school staff, our administrators, they are at maximum capacity. So we're trying to be diligent about the process. We know we need to have testing, but with some of these programs that are available at no cost or low cost, it will result in a significant workload for our staff. And as we want to have those staff persons to be available for instruction, we want our principals to be able to be instructional leaders, and we know thus far they've not been able to do that, just being quite frank. So we're really trying to be diligent about finding a solution that enables us to have the safety measure, but also implementing a system that can be sustained. We are just in September, and we don't know how, and we know that our principals and our staff can't go on like this for 9 more months. And so that's just being fully transparent of where we are, and we're really just trying to hold very firm to providing a solution that doesn't add the heaviest lift. Everything added will add some workload, but trying not to add that significant lift on our school staff and administrators.
I appreciate that. Again, this is talking about partnership. So, and we've spoken to this, and Dr. Boyd, you used the examples, the examples with the younger Sloan. But are we actively working on a plan, Dr. Brabrand, to see what can Inova do for our vaccine clinics? What can the health department do? So do we have an active plan in place?
The answer is yes. I convened Inova senior leadership, Dr. Gloria and her senior leadership, the chapter president of the American Associations of Pediatrics, Dr. Marin, who is frequently communicating with you, and Dr. Board and myself. We've committed to meeting every 2 weeks now, between now and frankly the time we're able to properly implement testing and vaccination across our community.
So that's the primary goal for this meeting, because you stated that, but you
Yeah,
didn't say specifically what you would
we
do.
had the meeting a week ago.
Right.
And we committed to staying, moving forward to meeting every 2 weeks. The schools have a big role to play. We are not the only part of this puzzle, as you know, and I do wake up some days going, you know, I never thought that the doctor and Dr. Brabrand would ever be associated with anything around true medical needs, because those folks are amazing people and do so much. But school systems have been asked to become front and center of this pandemic on so many health-related issues and decision-making. I wish it weren't so, but it is. And so now we just have to embrace working with our community partners and figure out the best way. We need the quickest, fastest, most efficient way to get our young people vaccinated and our remaining staff, and then to do the appropriate testing for those few folks for religious and medical exemptions that won't be. So ANOVA has expressed bandwidth concerns, I'll be honest, just like the pediatricians have. I want to be very candid. I hope ANOVA's not going to call me and be mad that I said the truth, but it is the truth. It's our reality right now, and we're going to have to collaborate unlike ever before to successfully execute what's going to be coming in the next couple of months. The thing we haven't talked about here is boosters, which, you know, again, as of last Friday, it looked like it might be more narrow. We'll know later this week. But even the more narrow interpretation of boosters, the advisory committee did support frontline workers for getting a third booster. Well, frontline workers are all of our school staff. That's tens of thousands of employees for a third booster. Yes, and well, our kids are in. So we've got a lot of work to do still over the next few months. It's not sustainable, but what I would say when I'm in my hopeful mode, and I still try to get there, honestly, is if we can get this final leg of getting our students vaccinated, of our mandatory vaccination process in place, that as we end this calendar year and move into 2022, we really, really, like I mean really have COVID in the rearview mirror. And that's what, again, I hope and pray for every day. And we're gonna, this team and our FCPS family, we've been under stress unlike ever before, but I do believe we can persevere and see it through, and we need to for our kids.
I appreciate that, and I do want to speak a little bit about what I've been hearing from my constituents. They, and what some of my colleagues spoke to, they do want some daily updates. I do continue to hear about outdoor lunches with tents still not up and picnic tables still not assembled. Also, I continue to hear from families, and this relates to your last point, about, yes, you hope it is in the rearview mirror by the holiday season, and I do too. But if it isn't, are you also in the background working on how we could expand the virtual options if that needs to happen?
I think if we're in the situation we're in at the end of this calendar year, we'll need to revisit our assumptions around how we're operating as a school district. I don't think that's too outrageous to say. It's the honest truth. And every school district in America, I think, would need to revisit their assumptions. As you know, the General Assembly did pass Senate Bill 1303 that required in-person instruction. And the General Assembly will be reconvening, frankly, at the end of this calendar year. And I think we'll be in a position to really know what we should be. This time, we need to recommend to the General Assembly what needs to happen. I think with all due respect to our General Assembly members, I am very hopeful. We all want to be back in person. We are back in person. We're going to do everything we can to stay. But we need to have the results of our experiences over the last few months to inform any additional General Assembly action. That's what I would say to you at this moment.
I appreciate that candor very much. And finally, I'll end with, I know you've worked with the teacher groups to talk about this plan, but I would ask you to continue your conversations with them to see if these, 2x2, every other day check-in, and if there is compensation available for that, if that becomes necessary, if it becomes burdensome because of the growth of everything that I just talked about. Thank you.
Ms. Tolan, may I ask your indulgence to let Mr. Frisch go ahead? He has a 4 o'clock, and then I'll come right back to you. Thank you so much.
Thank you very much. Returning to the topic of vaccines, I echo Ms. Marin's belief that we really need to strap ourselves in and do everything humanly possible to get students vaccinated, especially if and when the vaccine comes online for our youngest students. To that end, I'm very interested, I'm very appreciative of the requirement of student athletes to be vaccinated, but I don't think it can stop there. What are we doing to make sure that in every aspect of our school system, where it is legally permissible, that we are requiring vaccination for participation, attendance, et cetera?
Yeah, Dr. Presidio referenced that in an earlier conversation thread. We are back with Division Council seeing what else beyond just athletics that we can look at, and we can provide an update at a future one of these sessions for you.
I would love to be able to have my turn without an interruption for once. I know, during my turn. Thank you. It would be great if we could put a fixed time on when that report's going to come back to us. I believe when the first conversations began around athletes being vaccinated, I sent an email requesting that information, and this is more than a month ago. Not that you guys don't have anything to do.
Well, I'll be so bold because I'm feeling it is my final year in Fairfax County to say this. I think your legislative advocacy, since most things have fallen to school districts, is to empower school districts, not the General Assembly, to decide who vaccinates students in their school district. I'd like to have that power right now, and if I had it, I'd be recommending for this board mandatory vaccination for all of our students upon full authorization from the FDA. It's got to happen, or we're not going to have the kind of public education Fairfax has come to know and love. It's got to happen. And we should not be, if we have the burden of doing the responsibility of educating kids, it should be determined by those officials closest to schools. We should have the right to determine who we vaccinate and not vaccinate, and not wait for the state to give us permission to do so.
I agree. As state legislative chair this year, I will be reaching out to colleagues to gauge support for either a letter to our delegation or for an update to the legislative package, because I think it's critically important. But in the interim, I can't wait to hear the guidance from our council.
Yeah, we'll get interim guidance of short of the state piece. Are there additional groups that we can provide that for? And I think that's something Ms. Sizemore-Heiser was getting at. Are there co-curricular or extracurricular activities beyond the athletic program that we could also extend the vaccination mandate to?
And then also, in addition to our clinics in our schools, I think it would be important for our regional assistant superintendents to work closely with the schools to determine other locations where we might help facilitate vaccination. I think of places like Graham Road Elementary School, where many of the activities that the community participates in are at the Graham Road Community Building, and a vaccination clinic there. As we all know, for those that are not refusing vaccination for political reasons, one of the driving causes of vaccine hesitancy is convenience. So getting into the communities, and obviously our schools are a great way to do that. In some places, there are other places where that can also be beneficial. A question on the sub shortage. I am 1,000% in favor of this additional funding for our subs. I received a message today from a teacher who was told in no uncertain terms during a meeting that leave requests were being denied because of the sub shortage. They weren't specific as to what kind of leave was being denied, but you can imagine that there are any number of reasons during a pandemic that somebody might need to take leave. And we have a responsibility to hammer that out so that people can take advantage of these benefits that we give them. And and that fidelity goes through all schools, because that means that in some schools, they're, able to offer those opportunities, and others they're not. I think I'm just about out of time, so I'll leave it there.
Thank you. Oh. Somebody's trying to steal his 3 seconds. Hold on.
Do you have any comment about the leave question as to whether that's being?
I can share with you what I've shared with our principals. We have started to have some conversations where we can on Fridays and Mondays when teachers take personal leave, is to just ask teachers, are there other times and places during the week other than a Friday or Monday, which is where we're seeing our strain. We haven't mandated that, and again, personal leave is through the supervisor. We haven't mandated that it can't be offered. And maybe I'll end up doing a division message that's clear about what we are and aren't saying, so the message isn't being taken away. We obviously know people have sick leave, family leave. We need to continue to honor those obligations. But we are trying to say in personal leave, if you have some flexibility to try not to schedule that doctor's appointment or that appointment you just personally need to do on a Friday or Monday. And I'll try to work to be clear.
Just to be clear for any teachers watching at home, there is no directive from Gatehouse that all leave requests would be denied.
No, there is no directive for all leave requests to be denied.
And Mr. Frisch, if you have the school where that statement was made, if you let me know, we can follow up.
All right. Thank you.
Thank you. I have Ms. Tolan, followed by Ms. Omesh.
Thank you. First of all, I would like to thank our HR department for all of the work, and Ms. Corbett Sanders for all of the work that we've been doing. Many phone calls over the last couple of days and weeks to do this bus driver pay increase, and to have it done by October 9th. I know you're going through huge hoops, and I really appreciate it. Dranesville has our share of double backs and bus driver shortages, so really appreciate that. I certainly support looking at the subpay review, and I want to make sure we get it right. So, would support really diving into it on October 5th, perhaps, just to see how we can do it in the best way possible. Also, really want to try to be proactive about how we can keep our kids in schools, and is the 14 days really the right thing that we should be looking at? Should it be 10 days? Should we have testing associated with it? There's a lot of information out there, and I hope that we can look at that sooner rather than later. I know you're waiting for the Delta variant information, and I understand that, but I hope that we could get that very soon. I also want to thank Sloan for the communication back and forth on what ISD is doing to get materials and things out to our teachers to assist students that are in pause or quarantine. And Sloan, I maybe wanted to invite you for a minute or two just to talk about, what's happening and what kind of materials are out there and available to help our teachers be able to provide the best education for our students.
Sure. Thanks for the question, and thanks for your advocacy on that issue. And the team is working really hard to try to make sure that we provide teachers with as many ready to go and ready to publish, ready to use resources as possible, so that teachers have those materials when students are out for COVID-related reasons and can supplement what they're providing and minimize their amount of planning and preparation time. So we're trying to make those materials that were created last year by a lot of our content specialists readily available, getting those included and integrated into the curriculum guides that were updated this year, so that those could be pulled over and ready to use. We're, of course, extending the availability and accessibility of a lot of our digital learning materials as well. So things like ST Math and Imagine Learning, so that, again, the intent is to really try to make sure that those materials are easy for teachers to find, ready to use, and easy to post to minimize the amount of preparation time when planning for students who are going to be out for extended periods of time for COVID-related reasons.
Great, thank you. Yeah, I heard the rumor that everything went away with Blackboard, and I was like, I know that is not true. So happy to hear that you're working on that. Wanted to, in conversations with principals and out of various schools about, I understand that we really are trying to keep our students in their community and included if they're out on pause or quarantine. But I am a little bit concerned on the workload on our teachers for, every other day. And just wanted to hope that we would be creative, that if we have content teams, for example, that can share working with students, that we're allowing them that kind of flexibility, or grade level teams that could perhaps, work together, talking with groups of students and checking in with them. I don't know what kind of conversations are happening around that.
Dr. Ivy might like to share some light on that.
I can just share that each of these situations is unique, and every time there's even a consideration that we might need to pause a class, the region calls me, I merge the call to Dr. Boyd, we assess how many staff we have, how many students are out, how many are in, and what are creative solutions for the students who are in to keep them in. And whether that's combining or, teachers teaming to plan, whatever the solution, we do our best. And so that's why we just don't have a blanket number that says after a certain number, the class pauses. And we try to look as creatively as possible. The other piece of this also is that sometimes students are only paused for a day or two.
Right.
And so we want to keep the class open so that they have somewhere to come, so they can come back and join, their class. But there's lots of different scenarios. We look at other staff we can possibly use, but at the same time, we know that, everyone is stretched and is doing the best, that they can.
Right, and I appreciate that. And I wasn't even talking as much about like pausing a class as just if kids are out. Maybe there's, 3 kids out in one class and 4 kids out in another class. Maybe those 2 teachers can share getting a hold of, the students on multiple times during the week. I see Sloan is shaking his head, so.
Sorry, yeah, no, absolutely. So many of our teachers do work in teams, either grade level teams or content level teams, and that is one of the things that we've suggested certainly would be, a very prudent thing to do, is to share that responsibility for reaching out and supporting the students. So we definitely would support that and encourage teachers doing that.
Awesome. With my 2 seconds left, I'll just say, please get your kids outside.
Thank you so much, Ms. Omesh, and then I'll take my turn.
Thank you. I do want to thank staff specifically for being proactive in what they presented today. I know that there are specifically certain pieces on bus driver pay, testing, vaccines for 5 through 11, outdoor lunch that you anticipated many questions and addressed in advance. I do want to also acknowledge Dr. Ivy for looking into how we can support our undocumented students, especially because they do have unique challenges in accessing vaccines. And I just want to put that out there for us to remember, and hopefully I trust that Dr. Ivy and her team will communicate that down to our schools. In hearing a number of the concerns folks have raised, I'm wondering if, in the same way we did a really nice job articulating the expectations for masking, using graphics and things that were easy for the community to understand, if we can do something similar in conveying some of the other standards that seem to be inconsistent across our schools. And that would be not only for our families, but for staff as well. Some of those, for example, the windows on the buses, length of quarantine, which I know that's coming. I heard you say that in terms of revised expectations. Who supervises lunch? Can principals assign staff, including instructional staff, to do that kind of thing? Should we have desk clusters where students are facing each other in the classroom, or should desks be set up differently? Are additional hours of work, what's a reasonable amount of additional hours of work, et cetera? I mean, the list goes on. I have a number of things here, but I wanted to ask if we could, in a similar way, just be very clear about what we communicate to our schools in that regard. I also wanted to, I hope to hear from staff about this, but I did want to ask if we have any sense of what spread looks like amongst music classes, especially those that use instruments, and whether we've considered documenting that separately.
I can take a quick comment about it. One of the things we did with music is we have both music mask for all of our kids that we bought through the pandemic last year, and those are still in force. I don't know if we've done a separate data study, and I don't think we found there to be any substantial deviation in spread in those classes from any of our secondary classes at this time. Is that correct, Dr. Boyd or Dr. Presidio?
Thank you for that question. I think as we think about our elementary, it's hard to decipher because we may go to music together where we're singing and have math, but we're also in math together and in English and things like that. So it's hard to decipher. We know we're both in Mrs. Jones' third grade class, but we don't know if that transmission occurred during music, during math, during lunch. So it's hard to flesh out that way. And we have not yet seen any trends at our secondary level where there are a number of students and their only connection is in a choral class or a band class. We haven't seen that yet.
Is that something we want to keep track of? I mean,
That's definitely, whenever there's an outbreak, so indicating that transmission has occurred within schools, we get feedback from the health department about that, such as, in previous instances prior to school opening in our sports, we knew that there was a connection between the quarterback and the linebacker. I probably should
No,
stay away from
exactly.
football. That kind of thing. But those type of things, so we do get that information. Likewise with the class, so we would be able to see if there was something at the secondary level that the connection between Michelle and Aurora was that we both have band, trumpet.
Yep.
right.
Ms. Summers, just a reminder, we're actually doing that. That's one of the reasons we did the vaccination mandate for athletics. 5 of the first 7 outbreaks were athletic related to start the school year. Practical arts, CTE, or any specific program, we'll certainly bring that to the board's attention and take the appropriate action.
Thank you. With the sub shortage piece, have we considered lowering some of those barriers to entry or reducing the red tape it requires?
Yes, Mr. McDonald can give you some real updates on that.
Yes, we have. So we have created new pathways for folks that have not met the minimum requirement of 60 college credits to include individuals that are enrolled in teacher prep programs, instructional assistants that may be retired that had years of service. So we have provided different pathways and flexibilities for folks to enter into that role.
That's very helpful. I would suggest the same perhaps for bus drivers, other than, of course, the obvious certifications and everything that they need. Because the other piece is reference letters, for example, et cetera, just additional pieces to think about.
If I may just add to my answer regarding reference letters, we do have that requirement in place, but we have ensured that we've minimized some of the hurdles that our retirees have to go through in order to be rehired, and that includes removing that reference letter requirement. We're able to use their last evaluation before they separated for the retirement, so we want to minimize some of that friction and get folks back in as quickly as we can.
Thank you. And then pivoting to compensation, just across the board, whether it's bus drivers, whether it's subs, or extra hours that teachers are putting in for check-ins, et cetera. Have we looked at what other counties are doing, what other localities in a similar situation are doing?
Yeah, we continue to explore. I don't know, you want to speak specifically, Sean, to the subs. We continue to talk to our counties a lot, and funny thing is many of them are talking to us. What are you doing? But Sean, you may want to talk specifics.
Sure, and actually the topic is timely because today alone there were 3 different questions that came through the Virginia Region 4 HR Directors Group related to subs. And so the feedback that I'm hearing is that everyone's pretty much in the same boat. They're noticing a downward trend in their fill rates since the beginning of the school year. They're finding it difficult to motivate individuals that are in their pool to come into work, and a number of individuals are considering examining their sub pay at this point. So it's a very timely question and topic that landed on that distribution group today. I do know that some other districts are looking at creative ways, again, to motivate folks through incentives, be it monetary or otherwise, when individuals meet certain milestones in terms of number of days worked. or a certain number of Fridays worked or whatnot. So that's part of what we want to be able to build as part of our continuum of strategies that we want to be able to employ.
Yeah, those tools and strategies are precisely what I'm thinking. You know, I know it's a national issue across the board, but perhaps in thinking of what we do as a result of that. Finally, until I go back, have we considered putting in place a reporting mechanism for these cases? I know I mentioned this before, but for example, X school has a soap shortage, X school has this thing. Other than just having school board members reach out to leadership team staff, do we have a formal structure in place?
We have a formal database, Dr. Ivy can talk about, that we look at daily around operational impacts and strains that Dr. Ivy reviews. Dr. Ivy, want to talk about it a little bit?
So the principals can put into a database if they have a critical need in coverage for any subject or type of employee. And the list will come out every day at 2 p.m., but they can put it in at any point, day or night, and it goes into the database, and an email automatically goes to the correct department, the regions, and to me. And so then, based on that need, departments automatically can start helping and looking to see what they can do to support. The regions can then review and see exactly where their schools have the most critical needs. And the way the departments of the regions communicate with each other is actually on Microsoft Teams. And so, we take the information, put it in Teams, and the department or the region responds. And we monitor that. The EAAs help us as well.
Thank you.
I'm going to go ahead and take my turn and then turn it back over to you guys to figure out what we do moving ahead, because we're already over time. One of my big questions, I guess, starts piggybacking on some of the sub conversation. Mr. McDonald, do you have a sense of how many long-term subs that we are currently employing right now?
I do not have that number with me, but I can certainly get it for you.
I just think, I look back, I look at our current rates, and I'll say 10 years ago, when I was a long-term sub in this county, I was making more than this, I think. And I can only say that our cost of living here in 10 years, our home values, what it costs, have changed exponentially. And so I believe the short-term rate, I thought that the short-term rate was $15 at that point. So I could be mistaken. Maybe that was the long-term rate. But I am really concerned about these rates, especially because we know this year with the shortage of teachers that we are having to call on more long-term subs. And to that end, I think what I would say in beginning my line of questioning about live streaming and recording and check-in is that we also have a lot of subs in the system right now. So what's the support for those subs to do any of these things?
Are you talking about subs to do check-ins, support with check-ins or something? Is that what you mean?
Check-in, live stream, recording.
I don't know. Let me take that idea back to our sub-team and respond to that. I need to reflect on that. Thanks for sharing that idea.
I also wanted to ask, it's been brought up by some SBITs about storage for recorded lessons. Do we have a sense of that? On Blackboard, it was unlimited. My understanding is Zoom, it isn't. Is that accurate?
So our Chief Information Officer is right behind. So Gotham, you come right on up there. And I do want to thank Gotham and his entire IT team for all the work that they've been doing to prepare us for return to school and getting devices in kids' hands, and just extraordinary work. So great to see you, Dr. Secchi.
I would thank you, and I would echo that for the entire team. The team going to the T-Specs and the S-Bits in the schools have done a tremendous job this school year, just turning around technology. As far as storage is concerned, it's not unlimited, but we are monitoring our storage very closely. We have, I think last I checked, it was less than 10% of the available storage that's being used since we have started using Zoom, which has been a few months now. So we feel at any point if we need to get additional, if the use dramatically goes up, we should be able to do that pretty quickly.
Mr. Sethi, one thing she might, and please correct me if I'm wrong, as teachers start to pre-record, is there any concern that that will tie up bandwidth for being able to use? I think that was part of what your question was. Are we worried at all that the collection of that material on Schoology is going to tie up bandwidth or in any way? And I'm not enough of an IT person, to be honest, either, to know whether that is the case.
So the uses we imagine, the use cases we imagine are teachers are able to record potentially in the schools, or they may be doing it at a different time of the day. It's not all simultaneously. The best test cases we have are when we ran hybrid teaching last school year. At that point in time, we had half the kids in school. We had all the teachers broadcasting, and that model seemed to be sustainable at least that point in time. Definitely more kids in school now, so we will look forward to that.
Thank you. And while you're here, I just want to tell you I appreciate, I have been, I know, in close communication with you about a particular school in the Springfield/Braddock district that's having trouble, and I really appreciate you looking into the bandwidth there. You know, I think my issue, I've heard many of my colleagues advocate for figuring out some way to better pay our teachers, and I'm never going to be somebody who argues against that, but I don't know that we can pay our way out of the pressure and what this is putting on our teachers to do this. And I feel like, what are we taking away? Are we taking away smarter goals? Are we taking away some PD requirement hours? Are we just add and add and add? And I recognize we're all in the middle of a pandemic, and our teachers are too. So we're adding here, and we know that there are going to be schools that will not be implementing this, and we know schools who will be utilizing. I just was sharing with you a class where we have 11 kids that are paused out of 22. How on earth is that teacher going to be checking in every other day with those kids, making sure that they're getting differentiated material? I don't understand how that happens.
Well, a couple of things. One, in those half and half classes, that's part of the revised look that we're taking, where we've kept that open and we're looking at what that right tipping point is to go to virtual to sustain instruction. That's one. Two, we are removing some professional development and really trimming professional development right now to just what's mission critical and essential. For example, we're continuing PD around our literacy, early literacy action plan, and you'll be hearing more about that in an upcoming work session. So we are trying to trim down that's pulling stuff away. We've delayed some timelines for principals and teachers around certain things, and we're going to continue to look at more that we can do to reduce the workload burdens. I really do hope, as I said, this is a temporary measure for a temporary moment and not a permanent plan, and we'll be mindful of some of the discussion board members had today. Are there ways to look for additional compensation or other things like removing additional workload from teachers?
And I just think we have to, at least at the RAS level, have additional supports for some of our schools, that this is going to be a huge, huge burden, and we have to help figure out that maybe it doesn't have to be the teacher that checks in, it may be somebody else in the central office, or maybe, but I don't know how people just keep adding and adding, even though I recognize that our kids need to be engaged when they're home. I 100% agree with that.
One of the things you've talked about is, just with me, if I might, you and I had a conversation on Friday. Are there schools that are just hot spots with everything? It's more COVID, it's more COVID recovery, it's more instructional support. Can we put additional administrators over at that school, other supports at that school, volunteers at that school? And so that's something Dr. Ivy and I are really going to talk about. Yes, we're looking, as she said, we have a database. We have a daily feed that principal can say, I'm at critical staffing, and we have a huddle. But we may need to find a way that we have schools, they're not at red, but they're in perpetual yellow, deep yellow every day. And what do we do for those schools, even over the next 3 or 4 months, to have an extra surge of support? So we'll follow up shortly.
Thank you, and I know I'm out of time, so I'm chastised myself not going over. All right, crew, I know that we're over time 15 already. I know some people have other commitments that they have got to get to, but we do have 8 people at least who wanted to go back Are we willing to try to run through 90 seconds, which I know is hardly enough time to say anything? And if you got to go, go. As long as we keep 7 here, we're in good shape. So are people amenable to that? I see a few nods. Yes, okay. All right, well then let's start with our go backs. Ms. Marin, I had you with a question mark. Do you want to go back? I'll come back to you. Ms. Keys-Gamura, I had you on to go back. 90 seconds.
Yeah, mine is really quick. With respect to positions, Dr. Brabrand, I'm really looking for a plan from you. It seems to me that there's difficulty with coordination with the county, particularly around health issues, but you have a vantage point that most of us don't have. And so I just want a plan from you as to what is needed. It seems like there's liaison services that possibly are needed. It seems like there would be a team. I don't know. And so I just want to clarify that is the genesis for my comments earlier. Tell us what you need so we can talk about the real needs as opposed to us telling you something and trying to figure out how to mesh it.
Thank you. I have Ms. Corbett-Sanders.
Yes, this is very quick. I sent this earlier this week to Dr. Presidio, and he gave me an excellent response, which is we know a number of our students who have been out of school because of the pandemic, when we were closed and only virtual. They couldn't do their service hours. They're now getting ready to graduate, and they are facing an impediment to actually achieving their SEALs and their commendations. Dr. Presidio suggested that we could change those hours, and I would like him to explain how we could so that we could get support from from this board.
Yeah, thank you, Ms. Corbett-Sanders. I appreciate you bringing that to my attention and to the board's attention. And we did something similar for the class of 2021 where we reduced the hours requirement to earn your service cord upon graduation, and we could certainly do that again for this class under the same rationale. But since that is something that really is within the purview of the board, before administration would take action on that, we'd just really like concurrence of the board to be able to do that. So we basically would cut the hours requirement in half in recognition of the challenges that students would have in meeting those service requirements for the class of 2022.
Could we give you a show of hands since it's a regulation and not a policy?
That would be fantastic. It doesn't have to be a formal board vote, but I just want to have concurrence of the board that would be okay.
So Ms. Cohen, could we do that today?
Okay, why don't we go ahead and do it while we have 9 folks here. Would you please raise your hand if you're in favor of allowing reduced service hours for receiving the cord at graduation? Sorry, your cord for your graduation gown. Community service cord. Looks like you've got them all.
Thank you very much, and thanks again, Ms. Corbett-Sanders.
Ms. Corbett-Sanders, was that it for you? That was it. I said. Excellent. All right, Ms. Marin, back to you.
Yes, I just wanted to confirm with my colleagues, I did send you language on the 3 motions that I voiced today, and I've already gotten some feedback from you all, so please do take a look. Again, it's one about directing the superintendent to convene community stakeholders. The second is directing the superintendent to establish a staff position related to public health, for which I'm also gathering budget information, but it should be nominal. And the third is directing the superintendent to adjust the ESSER budget further to fund increased health and medical needs. Just a point on that, we approved the ESSER plan that went to the state on August 26th. So we are barely a month out, but look at how much has changed. So I do think that it is appropriate to, that motion is not about saying exactly what needs to change, it's directing the superintendent to relook at it in light of what we're experiencing and see what could change. Thank you.
Excellent. Ms. McLaughlin, and then I have Ms. Sizemore-Heiser.
Yes, thank you. I wanted my go back because, Dr. Brabrand, I'm very concerned about the plan that you devised on the teacher check-ins with the students. As you know, I'm a big advocate for the Zoom live streaming. I still don't even like that it's just for language arts and math at the elementary school level. We have technology, let people just sit in and watch, but I'm also mindful of the teacher time. So it was my hope today, but I know our time was limited, that the board would have directed you to work with your team and working with the teacher associations to revise the plan in some manner. I think that, especially at the high school level, these students are trying to keep up with their classes and with their homework. They don't even have the bandwidth to then go check in with 5 academic teachers on top of everything. And those teachers don't have the time when they're carrying 120 to 150 kids, depending on, again, how many kids are paused. So I know that one solution was that you just have a designated teacher who's agreed to extra pay, which we can use through ESSER funds, to just check in with the student to give them that human touch. But it's not like a paused high schooler or middle schooler suddenly has 5 teachers they've got to talk to and vice versa. So I appreciate your heart's in the right place. It always is. But I think that one's going to need some more nuances before you put it in place, is my feedback.
Well, I'll simply say we had a long and hard discussion. You know, that this is the cadence we established. The board always has the right to direct the superintendent on any matter. I mean, we saw it as an operational thing. We certainly brought you the preliminary. We've tried to balance with every group. I can't tell you the number of hours that we spent trying to find the right balance, but we'll always respond to board a decision from the board of a different way to go. We're trying to keep the lifeline to the kids to stay involved in school. That's the part that we're struggling with. But we also know, yes, it's one more thing in a pandemic. Like, how many one more things can we take? So I get the total point that you've made.
Well, like I said, this on social media and emails we're getting from teachers, this one threw them for a huge loop. Live streaming's one thing. Now having to do one-on-ones is a totally different thing. So, colleagues, I think we're just have to email Dr. Brabrand, but we're getting blamed right now. If anybody isn't aware of it, the board is getting blamed for putting this burden on teachers.
Thank you. I have Ms. Sizemore-Heiser, followed by Ms. Darna Kovacs.
I just wanted to clarify from what Ms. McLaughlin said. It doesn't have to be one-on-one. I just want to make sure I'm understanding this properly.
No, that's right. It can be a group. You can meet with all the kids at one time.
So I just wanted to make sure, because I know I think there's some confusion teachers about thinking that they have to do 15 minutes with one student, then another. So I wanted to help make sure our teachers.
2 nuggets. It can be individual or group, and there's no time length. The check-in can be quick. Some kids are going to be, hey, Mrs. So-and-so, you got it? I got it. I'm good. Some kids, I mean, it does depend. We tried to put maximum flexibility in. Our cadence, and again, I'm not going to lie, did we have a lot of back and forth? Some people thought every other day. Some thought weekly. Nobody thought less than once a week, by the way. I just need to be totally candid with you. Some thought twice a week. We landed on every other day. And, again, that was our best thinking. If the board ultimately directs differently. But again, I brought forward what I thought was just the best after taking all the stakeholder input and trying to land in the right place for kids.
And is it mandated for students? Is there some sort of check in case students aren't checking in?
I don't think we have that yet. Douglas Reeves, who is a great educational researcher, said you can learn about implementation during it. I think if we find that becomes a problem, right now our thinking is kids are going to want the check-in because they're on quarantine. But if kids don't, I think we'll have to work through a protocol for kids to who are not wanting to. But I'm hopeful that's not going to be an issue. But it's definitely something we'll flag and keep an eye on.
I could ask questions for hours, but I will donate my minute and 11 back in absence of time. Thank you.
Thank you, Ms. Sizemore-Heiser. Ms. Darna Kovacs, followed by Ms. Tolan, and then Ms. Omesh.
Thank you. I just want to say, as I stated earlier, I do appreciate the option for teacher outreach. I think, I always put my mom hat on and say, if my kids were in this position, what they would need at all levels, either elementary, middle, or high. And I do appreciate that. As I asked Dr. Brabrand, and I know you and your team will do this monitoring to ensure that if it becomes excessively burdensome, that our teachers are compensated adequately and, or, get some kind of recognition for this. I also want to talk, Ms. Marion, you spoke about your establishing a staff position. Dr. Brabrand, have you thought about that? Because Ms. Marion, you put this as for Thursday evening, and I'm not certain I would be ready to make a decision on that, particularly if Dr. Brabrand and Dr. Boyd have not, put this in a place where I can understand what exactly it would look like.
Yeah, I mean, I guess I'm just an all cards on the table person, always have been, and not going to change now. We haven't thought about a chief medical officer, I'll be honest. We had not thought about that. We had thought about, and I had not shared with the board at this point, we had thought about an executive director position that reported to Dr. Boyd that was specifically focused around health issues, almost a chief medical advisor to Dr. Boyd, because so much of her work is done.
And again,
But I'm not ruling anything out, and maybe between now and Thursday we can come up with, when. Yeah, I don't know when. I don't want to be in the middle of that right now. All I'm just saying is we're actively. I'll let the board decide how it wants to. We're actively and I can do the executive position if I needed to, if the board didn't. I mean, I could. I'd rather work collaboratively, of course, on that. But here's what I know is what I said to you earlier today. I've already come to the realization Dr. Boyd's current task in front of her is not sustainable under these conditions. And I've got to figure out a way to decouple some of the medical from the special ed. This audit today saw her path ahead that she has. It's not fair to any human being to be asked in the pandemic to be running the pandemic leadership for the system and then also trying to do special ed. So we've got to figure out what it looks like. I'll certainly be willing to collaborate with you on that in more detail.
Right,
At the time and place of the board's choosing.
Dr. Boyd yesterday to tell her some of my observations, and I said to her publicly too how much I appreciate you and all the work that you've done. And I think if that needs to happen, I just like a little bit of thoughtful. And it could be one of those things that could be just a year, during the duration of the pandemic, and somebody else had spoken about that as well. So, all right, thank you.
Thank you, Ms. Darren at Fairfax. Ms. Tolan, then Ms. Omesh.
I just wanted to follow up on this idea of the check-ins. I thought part of the conversation that we had earlier was that schools could be flexible in how that happened. Sloan, back me up if I misinterpreted that different people on teams could share checking in with students, content area teams, grade level teams.
Yeah, no, absolutely they could. And I think what Dr. Brabrand was just trying to stress is that, we want to maintain that connection to what's happening in the student's classroom as much as possible. But again, as I had said, many times teachers are teaching the same content at the same time on a grade level team or on a content team, and we definitely think that teachers could work together to share that responsibility. So I think we're saying the same thing.
Thank you.
Ms. Omesh?
Thank you. Just picking up on the reporting mechanisms conversation we were having, I would just advocate that we might consider ways that are not just through the principal. I think a lot of times teachers on the ground have concerns in different places that are not necessarily reported to their school leader. I don't know if we don't have that in place, right?
Could you clarify, are you talking about lessons? What?
Sorry, reporting mechanisms for, implementation problems or shortages in certain materials, not lessons, but, as I mentioned, soap or masks or things like that.
So we have other mechanisms for other staff to report. That would be perhaps the region through the ombudsman.
Yeah, I guess as we head into with Delta and everything, I think the concerns are only going to increase. And I don't just mean kind of the standard of what we're doing with COVID mitigation strategies and what staff require on a school-based level.
Well, let me take that feedback back, and Dr. Ivan and I can reflect on it. I don't have the solution.
Mr. Tyson has
Oh.
a thought.
Well, Mr. Tyson, come on up. Mr. Tyson, of course, is our Region Assistant Superintendent for Region 1 for those who may be watching publicly, and I'm glad to have Mr. Tyson with us today.
Thank you, Dr. Brabrand. Ms. Omesh, if I understand what you're getting to, if I'm in a school and whether or not I'm having shortages of actual supplies in a school is what you're getting to, yes, we do have those mechanisms that are pre-COVID. And so therefore, if I'm a building level leader and I'm running short of any supplies, for instance, now we might be thinking about hand washing or sanitizer, something like that, a school definitely can interface with the Office of Facilities and Transportation and order those things, and those are sent out through the warehouse. If the schools have delays on those types of things, then obviously they would interface with the region, and the region would interface with Mr. Plattenberg and make sure that get those things out. But in terms of interfacing with the warehouse as well as with Mr. Marty Smith in terms of making sure that we have those supplies in the warehouse, I can assure all board members that the warehouse is adequately supplied at this point in time, and we're getting things out. And if any school is having problems getting any type of supplies, particularly sanitary supplies, out to schools at this time, all they would need to do is to interface with the region office, and we would assist. Thank you.
No, I appreciate that. And when I say, reporting, I guess I'm referring to even more broadly, right? So materials is certainly one. Another could be, these expectations that we've lined up for the school communities are not happening at this school. The buses for this school are not opening their windows, or, we have students sitting in clusters, and things related to safety that are not just material.
Yeah, and I appreciate where you're getting to. And as we all know, it has been a bit of a problem-solving scheme since the beginning in terms of whether or not, for example, the example that you gave of whether or not we're putting students in clusters in group learning, so to speak. We have tried as a system, and I know we've discussed this in the board as well, that we're trying to mitigate that as much as we possibly can. Just as we talked about with regard to lunches, we've tried to, initially put rectangular tables and put kids facing, if not in one direction, but in opposite directions away from one another. And then, of course, as Ms. Tolan mentioned earlier, trying to get kids outside as much as we possibly can. So that's definitely it. With regard to the buses, yes, we want as much ventilation going on in the buses as we possibly can. And that is something that definitely Mr. Plattenberg has talked about earlier, that we're emphasizing that with our drivers. In our schools, which of course some of our parents ask us about in terms of opening windows at schools, things like that, actually the information that has come out, not only through our school system, but is nationally through CDC, is that it is actually counterproductive to making sure the airflow is consistent in our schools in terms of keeping the windows closed. Thank you.
Yeah. So those are examples, right? What I'm trying to highlight here is we need some kind of system in place for people to report these things so that they're not just, the random person who knows to contact their school board member and then the school board member forwards it to someone else,
We hear you. Let us go back and think about that some more and brainstorm. We have different avenues, but I understand now what you're asking.
Okay, thank you. And of course, the last bit of time I have on the teletherapy part. Can we talk a little bit more about that? I was thrilled to hear it. I don't want to get too excited without knowing exactly what it entails, but.
Yeah, so just at a high level, it pretty much enables provider to be able to provide the services via teleconference. So it's the therapy, the same version of therapy that was provided when we were all virtual, but we do have to have parental consent. But if parental consent was on file last year, there wouldn't be a subsequent need to provide that again this year. So it's just a different provision model that will be done via teleconference.
My time is up. Thank you.
Thank you. I'll just take my turn super fast. The 14-day rate, I think it would be helpful to 14-day quarantine would be helpful for the community to know, is this something that if our positivity rate as a community goes down, this is where we do a relook? Or is this something as vaccine rollout go? I think getting some idea of like when that might be evaluated or reevaluated is real helpful to the community.
So what I think is fair to say is I can commit to you that we'll have a monthly update reviewing our COVID data, community transmission data, and our talks with the health department and our senior leadership determinations from Dr. Boyd's recommendation, and I can do a monthly update around that to the board.
Thank you. I also just want to ensure when ISD is doing these wonderful ready-to-go resources that we do not forget about our SPED teachers, because there were not things that were adapted for them last year, and it
Absolutely.
Okay.
Absolutely.
And then the last thing, the bus driver steps. I know we didn't get a chance as a board to really like go through and see what it meant for each step. I just want to make sure that this does not turn into principal parity pay, where all of a sudden bus drivers are coming to us and saying, hey, whatever we did, whatever you guys did screwed us on X, Y, and Z things. Like, I want to make sure we're really doing for every person driving a bus, that they are going to see an increase in their pay starting October, whatever date we said.
Mr. McDonald, do you want to comment on that?
Sure. So anyone that did not receive an increase as it related to bringing the floor up to 2291 will see an impact to their pay of 2.5%. So there are individuals that are on bus driver 1 that previously are on steps 1 through 5. They've already received more than a 2.5% increase by bringing that floor up, so they're not going to see a change. But anyone that was at 2291 or above will see that 2.5% increase effective October 9th.
But
We are, yes, so we're going to take this action here and make the adjustment to the scale at this point. But we're also still working on a market study for bus driver pay, and that was an outgrowth of a motion, a follow-on motion as part of the budget process last May. So that's still ongoing, and we'll look at how our rates compare to the market after this 2.5% is applied.
so if you've been driving for 5 years, are you now being treated the same as somebody who has been driving for 1 year?
No, so there'll be a differentiation there. So those individuals, if they hadn't received an increase as part of that bringing up the floor, then they're gonna have a differentiation in their pay. And go ahead.
Everybody's going to get more money. That's it.
Like Oprah with the bus drivers is what I'm trying to communicate to you, because we are all going to get these emails as soon as we get home. If everybody gets more money if they're driving my child on the bus. Everybody gets more money. I just want to use my last 16 seconds to say thank you all so much. This was a beast of a meeting, and thanks for everybody's cooperation trying to get through. I know we still have a lot of questions that have not been answered, and we'll keep going. And anyway, adjourned. Thank you, guys.
Thank you. See you Thursday.